Hi everyone, it's Paul O'Boyle again from Riverside Dental Practice. I just thought I'd make a follow-up video about some of the common things that we see every day. So today on this video I'm going to talk to you about one of the most common things that we deal with every day down at Riverside Dental Practice, and that's the problem of tooth grinding and tooth clenching. This is becoming much more of a problem now, and so more and more patients are waking up with headaches or neck pain or jaw pain. Sometimes the teeth can get very sensitive because of this. So what happens is they turn up at the dentist and they're very often fairly convinced that they need a filling, or that they must have an infection, or even in severe cases that they need a tooth out. In fact, most of the times that I've seen adults in really bad way with pain, it's because of tooth grinding and clenching. So it's real pain. If you put a tooth under massive pressure and you really crank up the pressure on that, it's either going to get squashed into the socket and become loose and really painful, or it's going to break or shatter or crack. So this is not imaginary pain, this is full-on pain, and we need to deal with that, and this is what we treat every day in Riverside. So it's a complicated enough area, but broadly speaking, I would divide it up into the patients who clench their teeth together, who just squash their teeth together in the one place, and they're very often the patients that come in pain, and they can present with pain that's radiating up behind their eye or behind their ear or down along their jaw, and very often will have quite sensitive teeth. There'll be patients that will be even quite difficult to clean their teeth because they're pretty jumpy. Their teeth are nearly always sensitive, and when you take a look inside their mouth, you can see why. We start to see various signs, marks on their cheek where they're biting their cheek all the time. Their tongue is getting squashed against their teeth, so it very often isn't your usual round tongue. It's got lots of little bumpy patterns in the side of it. If we look really closely, we've got some high-powered magnification microscopes in the practice, and we can really zoom in on teeth, and the cracks show up really widely. It's fairly obvious. So when a patient comes in pain with a tooth, we take the usual x-rays and checks and make sure it isn't decay or isn't infection, and then we start to look around at the rest of the mouth. We see a history of teeth breaking in the past. Patients come in and say, yeah, I had a problem over the left side, I had to get some teeth out, now the pain is over the right side. That kind of history, where they've gone elsewhere and dentists have taken teeth out or done fillings, and then the pain seems to magically go somewhere else. So this is an area that's of real concern to patients. People are losing teeth over this, and so we've had to really address it. The other kind of patients that would come in and might find it a surprise to be told that they're grinding their teeth are the patients who don't so much clench their teeth together. They're the patients that slide their teeth side to side. And they'll just end up having shorter teeth, and very often the first sign that they have a problem would be when they look at photos. They're at a wedding and they look at the photos and they see they can't see their teeth. Everyone else is showing big smiley white teeth, and they look like they have taken their dentures out, and they're wondering why, and they have a look in the mirror and they don't really notice a difference because it happens so gradually with them. It might take 20 odd years to wear down a couple of millimeters of teeth. But it gets to the point where the teeth disappear up behind the lip, and that's usually when we have to intervene. So I just wanted to go through a short video to explain to you the kind of things that we do for that in Riverside, and broadly speaking the cause of this problem. So basically I brought in these models just to show you guys, and just to briefly describe what our teeth do and the reason that they're the different shapes. So if you take a look at the model there, we've got our back teeth are a completely different shape to the front teeth. Our back teeth are essentially cogs, and our front teeth are ramps. Back teeth have got these points, these things called cusps, and they have a few of them on them, and so they're the perfect shape to withstand downward pressure. They can withstand huge pressures. Basically the jaw muscles are the strongest muscles in our body, and they crank up massive pressure just here, which is where our back teeth are, and they're the exact perfect shape all the way to the tip of their root, to spread out that load and withstand downward pressure, and they interlock a bit like a rugby scrum. They lock together like cogs in a gearbox when we press on them, and they spread the load out, and that's brilliant for downward pressure. It's not so great at sideways pressure. If you have teeth that are all locked together perfectly, and then you start to go side to side without taking them apart, you're going to end up either loosening the teeth, making them pretty sensitive to cold or to sweet or to hot, or you're going to start to snap pieces off the tips of the teeth. And very often a patient will come in with the filling intact, but the tooth is snapping around the filling, and they end up needing crowns and wider, bigger fillings and problems like that. So nature has found a way to avoid that, fortunately, and that's the front of our mouth. The front of our mouth have these ramps, these canines and these incisors, and they're the exact perfect shape to guide the lower jaw to stop it breaking up the back teeth. So if I have a look at this model here and I start to slide, on this side of the upper model I've left the teeth intact, and on this side I have ground it down with my drill to simulate what happens when you have teeth that are the wrong shape. So when our teeth are the right shape and we haven't ground them down, when you slide your teeth over to the right hand side in this model, I can't even see what's going on, but I can tell you what probably is going on, and that's the fangs are touching each other and nothing else pretty much. And that's because the fang is the tallest tree in the forest. It's the one that the lower teeth have to hit first, and it's the perfect tooth for that job. It has a massive big root. You'll hear people calling them the eye tooth, and that's because the roots of our fangs actually go all the way up to here. And that tooth is shaped like a ramp. It's really hard to grab hold of it. When you're grinding your teeth together, you just tend to slide along it, and it creates a gap at the back. So when we chew, we slide along and we get a gap at the back of our mouth, and food goes in there and we squash it in and we slide again. So the back teeth, they're never really having to take any sideways pressure at all, which, as I said before, is just as well, because they would start to pull each other apart. The problem arises when we have ground our teeth down for 20 odd years and we've got to the point where our fangs are no longer pointy anymore. So if you have a look in the mirror when you get home and you're talking and you're looking to see, have you got pointy fangs? Have you got nice vampire pointy fangs, or are they flat and dull? Now a certain amount of dullness is fine, but when we get to the point where they're completely flattened and they're starting to look like all the teeth beside them, then they're no longer doing that job. And when we slide our teeth over to the left hand side in this model, where the fangs have been ground away, we start to see that now we can get the back teeth together. Whereas on the other side, it's pretty much impossible for me to grind my back teeth together in this model. When I go to decide that the damage has been done, it's pretty easy. And then we end up with problems like sensitive teeth and eventually broken and chipped teeth. So when we have that situation, very often the patient is saying that this tooth back here is really sore, I think I need a filling. And we take a step back from the problem and we start to look at the shape of the front teeth and the fangs, and we realise actually that doesn't need a filling at all. We need to restore the guidance at the front of the mouth. And we can do that a few different ways at Riverside. We do this all the time. We can either restore the shape of the front teeth by putting white filling material or even veneers or crowns over them to bring back the height of the teeth back to the shape it's supposed to be, so it can go back to doing its job. Or if the patient decides that they're happy enough with the appearance and they just want to stop the damage going any further, we can get back that guidance by putting a guard in. So we put a nighttime device, a little plastic ramp at the front of the mouth that they click on at nighttime, and then when they bite their teeth together, they're not physically able to get the back teeth together anymore. And that very often relieves a lot of the symptoms of the headache and the sensitive teeth and the jaw pain. And when we get the patient back for the series of reviews after a week and a month and 3 months, we start to see a massive improvement in the quality of their sleep, and in the ability to chew, and the pain that they had and the sensitivity is gone. So all of these fillings that they thought they needed, turns out that they didn't need them in the end. So we get some nice results there, and it depends on which way the patient wants to go, whether we're going to build the teeth up or get them a guard, or maybe even both. So hopefully I've given you some kind of insight into the kind of things that we do that aren't just all about obviously filling and drilling decay away, and that we're always trying to find ways of avoiding to the need for that kind of treatment. And if we can do some preventative work, that's always the best way. Talk to you soon.